Hello everyone, today I'll be introducing parasitic infections and treatments, Albendazole and Mebendazole. First, I'll introduce parasitic infections, then about Albendazole and Mebendazole, and lastly their efficacy and comparison. So now, what is parasitic infection? Parasitic infection is cases of infection with roundworms, whipworms, tapeworms, liver fluke, lung fluke, intestinal fluke, and other more parasites. Parasites are covered with a cuticle layer so that they can live in the human digestive tract, but dead parasites cannot maintain the cuticle layer, so they dissolve in human gastric fluid or digestive fluid and cannot be identified in the stool. Parasitic infection can cause fever, fatigue, intestinal symptoms, skin rashes, or neurological symptoms. You can get them from contaminated food, water or surfaces, bug bites, and eating undercooked meat. Now, I'll introduce some kinds of parasites. Nematodes are pointy-shaped at both ends and include roundworms, tapeworms, whipworms, and whale roundworms. It is the group of parasites with the highest frequency of infection. Flukes are commonly known as schistosomiasis and are characterized by leaf-shaped flatness. It is infected when raw pork or beef is consumed or when drinking contaminated water. Schistosomiasis has a body which is segmented, and it includes non-structured worms, larvae, and nematode worms. Endomytics is also known as Toxoplasma gondii, which is a single-cell parasite, and it is very weak so that most people don't have any symptoms. This time, I'll explain kinds of parasitic diseases. Soil-transmitted Healthyi infections are among the most common infections worldwide. They are transmitted by eggs present in human feces, which in turn contaminate soil in areas where sanitation is poor. The main species that infect people are the roundworm, the whipworm, and the hookworms. Next, foodborne trematodes are zoonotic and become infective only after completing a complex life cycle that involves stages in intermediate non-human hosts. It causes infection in humans via the consumption of contaminated food like raw fish or vegetables. Clonochiasis and opistrochiasis, which are types of foodborne trematodes, should be administered at a dose of 25 mg 3 times daily for 2-3 consecutive days, or a single administration at 40 mg. Schistosomiasis is an acute and chronic parasitic disease caused by blood flukes of the genus Schistosoma. People are infected during routine agricultural, domestic, occupational, and recreational activities which expose them to infested water. When female worms hatch eggs, some of them are passed out of the body in the feces or urine to continue the parasite's life cycle. Others become trapped in body tissues, causing immune reactions and progressive damage to organs. Large-scale population treatment with praziquantel is required. Now, I'll introduce you about the treatments, Albendazole and Mebendazole. Albendazole and Mebendazole are most frequently prescribed for treatment of intestinal nematode infections, and they can also be used for intestinal tapeworm infections. They cannot be administered to pregnant women or children under 2 years old. I'll tell you about Albendazole more specifically. Albendazole is a tablet to take by mouth, used to treat infections caused by worms. It works by keeping the worm from absorbing sugar, glucose, so that the worm loses energy and dies. The principal mechanism of action of albendazole is inhibiting polymerization, and the cell division process of parasites. Additionally, albendazole hampers egg production and thwarts the hatching of any pre-existing eggs. It is also used along with surgery to treat cystic hydatid disease, which is infection caused by the dog tapeworm in the liver, lung, and lining of the abdomen that may damage these organs. The photo on this slide shows the process of making albendazole. Mebendazole is a chewable tablet, and it is used to treat roundworm and whipworm infections. It is used to treat pinworm, whipworm, roundworm, and hookworm infections. Mebendazole is usually taken as a single dose. The photo on this slide shows the process of making mebendazole. Since these are medicines, they have some side effects, but it happens to very few. Albendazole can cause stomach pain, nausea, vomiting, headache, dizziness, reversible hair loss. And mebendazole can cause diarrhea, stomach pain, discomfort or swelling, nausea, vomiting, loss or appetite. Now let's talk about efficacy and comparison. The process and efficacy of albendazole and mebendazole are similar since both of them are for the treatment of parasitic infections. But single-dose albendazole has better efficacy against Ascaris lambda, which is parasitic worm infection, than mebendazole. And this chart shows that albendazole has better efficacy than mebendazole. Thank you for listening. If you have any questions, you're free to comment on this video. Bye.